Hi, it's Dr. Jenny and Dr. Daniel from Spinal Corrective Center in Amherst, New Hampshire.
So we have a lot of patients here who come in and they tell us, so they came in for one thing,
Yep.
and after being under care, they come in one day and say that something else that we didn't even know about has gotten better. So Dr. Jane, do you have any
Sure.
stories of a patient that, something like that?
Yeah, because oftentimes the thing someone comes in for is an obvious pain syndrome or something they can really feel. So for example, this is super common. Someone might come in with back pain. So I had this one guy, he had cyclical, meaning every 3-4 months he would have the same pain right here. He'd be bent over, didn't like doctors, didn't want to go. Finally, he couldn't go to work. He was a mechanic. He's like, I have to take care of this. So he came in, didn't give me a lot of information. It was just pulling teeth trying to get this guy to tell me anything. So all I really knew was that he had pain here. He was bent to the left. The x-ray was obvious. His spine was degenerated at that part, meaning there was arthritis. So we knew that there was subluxation, or there was a locking up of the nervous system, and locking up the spine, and the nervous system was agitated. And it had likely been there for quite a long time, maybe 15, 20 years plus. So we're focused on that, right? So we're adjusting this area, and his goal was to get back to work,
of course,
which he did. But thankfully, we had kind of explained to him how this pattern had happened, and we really wanted to help him break the pattern, right? So he's getting adjusted. He's actually finally out of pain, and he kept coming in because this makes sense. This makes sense. Just like he helps people with car alignment, so their tires don't lose air unevenly. We were helping him find alignment in his spine, so he didn't have pain cycles.
Of course,
same idea, right? So third week under care, he comes in and says, "Doc, it's a miracle you cured my heartburn." I'm like, "You had heartburn?" I didn't know there was no heartburn adjustment. But I totally understood it clinically. So where his spine was so subluxated, it happened to also be nerve supply to the stomach and to the esophagus. So sure, it wasn't just pain syndromes. It was actually his nervous system had been weakened, had been stressed for a period of time. And it wasn't a miracle. It was just allowing his body to go back to normal.
Of course. And so you're saying basically that pain isn't always the best indicator of what's going on in your life?
No, in fact, only about 10% of your nervous system even has pain fibers. So it's very possible that you have stress or weakness in your spine causing stress and weakness to the body that you don't even feel.
It's true. So it sounds to me that you can make the decision to be reactive about your health, so coming in when you experience pain, or being proactive, so making sure that you're going in there and these things that aren't necessarily apparent are getting taken care of before they're a problem. Yeah,
it's basically trying to keep balance and the least amount of stress on your body so you don't have to wait until it creates a problem, right?
I think that's something that a lot of people understand in other aspects of their life. So you go to the dentist to make sure that your teeth are healthy and you don't get cavities, or you remove the cavity before, starts tooth decay.
And some people only go to the dentist if they have tooth pain, but we kind of all know that's not the ideal way to use dentistry, right?
So it seems like we should have the same mindset when it comes to our spine and spinal health.
It's true. Well, and I think it's another reason people see the value in getting their children checked, because why wait till their children have the same problems they do? They have a spine, their spine is growing, so the value in maintaining a healthy spine is there.
It's invaluable.
It's true.
So I think one thing that I try to tell all the patients that come in is not just about feeling better, it's about functioning better.
Yeah, and it's not just how you're feeling, it's how you're healing. So
Absolutely.
That one rhymes. That was
rhymes.
good. I
That's
like
good.
punching. Be well, everybody.